Okay guys, Timmy coming at you here. And today what I'm going to do is I'm going to go over the medications used to treat type 2 diabetes. Remember that in most cases, type 2 diabetic, insulin is not their problem. Their problem really is that the number and sensitivity of these little insulin receptors on the cells of the body just go away. There's less of them, and they're less sensitive to the insulin that's released. So if you recall, I explained to you before, if you watch the Little Functions of Insulin video, that in order for glucose to go from the blood into the cell, insulin has to be released by the beta cells of the pancreas, and then it has to bind to a functioning insulin receptor on the cell membrane. So in the case of type 2 diabetes, the number of these little insulin receptors on the cells of your body goes away. The result is that you can't lower your blood sugar. So in the early stages of type 2 diabetes, insulin is not their problem. As a matter of fact, many of these people are hyperinsulinemic. They have many times higher normal circulating levels of insulin than a person without diabetes. In type 1 diabetes, this person has no insulin. So what I'm going to do is I'm going to explain to you the different ways that you can elevate your blood sugar, and then again it makes perfect sense. If you're a type 2 diabetic, your blood sugar's high. Boom, right? So what are the ways that you can elevate your blood sugar? And then real smart people with the tape and pocket protectors, they formulated drugs that affect the ways that you can elevate your blood sugar. That's how it works. So take a look here, right? One of the ways that you can lower your blood sugar is by preventing your GI tract from digesting the carbs. If you can't digest carbohydrates, then you can't absorb it into the blood and you can't raise your blood sugar. So those are the alpha glucosidase inhibitors. That's how they work. Then, where do you store some extra glucose? In the form of glycogen. That's your liver. So there are drugs out there that prevent the liver from dumping glucose into the blood, and those are the biguanides. Metformin being the man, the player, the pimp of treating type 2 diabetes. Metformin is the drug that is almost invariably given to a patient with type 2 diabetes. The reason for that is metformin, its primary function is to prevent the liver from dumping glucose into the blood, but it does have a little bit of effects of preventing glucose from being absorbed from the GI tract, and it also increases the number and sensitivity of insulin receptors. Not as well as the other drugs, but it still has its effects. So that's why metformin is the first line drug in treating type 2 diabetes, almost invariably. The other way that you can try to lower your blood sugar is simply overwhelm those lazy, decreased number and sensitivity of insulin receptors on the cells, right? And one of the ways that you can simply overwhelm them is by causing the pancreas to release more insulin. And those are the sulfonylureas. And the sulfonylureas make the pancreas release more insulin. The problem with those drugs is that they can lead to premature pancreatic burnout, where you basically fry your pancreas and it ain't going to release any more insulin. So this person, when they suffer this pancreatic burnout, they now have to take insulin. So they are still a type 2 diabetic. Their primary problem is still the decreased number and sensitivity of these insulin receptors, but their pancreas is fried, so now they are a type 2 diabetic that is insulin requiring. The other way that you can lower a person's blood sugar, and this works out really well, especially in patients whose blood sugars are not well controlled with metformin. These are the thiolidazine thiazolidinediones, cut it out, right? That is a huge word to explain the drugs that increase the number and sensitivity of these insulin receptors. And these insulin receptors are proteins. If you recall from your A&P, DNA inside the nucleus of the cells builds protein. So what these drugs do is they tell the DNA to build and put on the cell membrane more insulin receptors. And this allows the better control of the patient's blood sugar. The thiazolidinediones. Nice. I'm actually thinking about naming my kid thiazolidinediones. Thiazolidinediones, come and do your homework. Or take out the garbage. Or say your name. The other way that you can lower your blood sugar is by preventing the kidney, and specifically the nephron, from reabsorbing that glucose back into the blood. So glucose is small, and it can easily be filtered by the glomerulus and then end up in the collecting tubules. But normally, if you're not diabetic, your blood sugar should never go over 180 milligrams per deciliter. And that's how much glucose can be reabsorbed back into the blood that got filtered by the nephron. But if you're diabetic, your blood sugar routinely goes over 180, say it's 300. Well, how much glucose can the nephron reabsorb back into the blood? Only 180. The result is that the rest of that glucose gets peed out in the urine. You get glucose in your urine. So a quick and dirty way to determine if somebody's diabetic, have them pee in a cup, dip it, and if there's glucose in it, they're diabetic. And the higher the glucose, the higher their blood sugar is. These are called the glyphosines. And what these do, the brand name is Invokana. What these medications do is they prevent the nephron from reabsorbing glucose back into the blood. So if you don't reabsorb the glucose back into the blood and you pee it into the toilet, your blood sugar is going to go down. The problem with that is this, is that as the glucose gets filtered by the glomerulus and ends up in the collecting tubules, it should get reabsorbed back into the blood. But if you're on Invokana, you're not going to do that. The result is that you're going to have a lot of stuff in the collecting tubules, and that is going to draw water from the blood into the collecting tubules, and you are going to pee out a lot of water. So if you ever watch the commercials for this one, they say, oh, one of the side effects is dizziness or lightheadedness upon standing, and dehydration. That's because these people are peeing out the glucose, and along with the glucose comes water. So those are the basic ways that medications work to control blood sugar in type 2 diabetes. And again, metformin, the biguanides, those metformin works on 3 of the 5 areas, primarily preventing the liver, but it works on increasing cell sensitivity and by preventing the digestion of carbs. So a lot of times they will give sulfonylureas in combination with metformin because metformin doesn't affect the release of insulin from the pancreas. Or they will give metformin and an additional thiazolidinedione. Nice. Because that increases the number and sensitivity of insulin receptors. Even though metformin has that effect a little bit, it's not as well as some of the thiazolidinediones. They really should change the name. I mean, for real. It's upsetting. Anyways, that is that. So just real quick, let me give you some examples. Biguanides, metformin. Why? Because it works 3 out of the 5 ways. It's a proven drug. Then the sulfonylureas, that stimulates the beta cells of the pancreas to release more insulin. So you got Amaryl, Micronase, Glucotrol. That's why a lot of times metformin and a sulfonylurea is given in combination to help control it. Then you have the alpha glucosidase inhibitors. That's a precursor glycet. And then the glinides I didn't talk to you about, but that stimulates the release of insulin from the pancreas, but it does so in a relatively short period of time. So it's given at meal times because you're going to eat and your blood sugar is going to go up. So, and it only works when your blood sugar is elevated. Well, the sulfonylureas, they work all the time by continuing production of insulin from the pancreas and its release. So these actually work pretty good, and they're given usually 3 or 4 times a day depending on your meals. So one of the things that you have to be aware of as a nurse is if this person is NPO and they're on Parandin or Starlix or Glufast, then you want to make sure that you hold that medication, because if they're not eating and then you give them a medication that's going to stimulate the release of insulin from the pancreas very quickly, their blood sugar is going to bottom out. And then you got the thiazolidinediones, and basically what they do is they increase the number and sensitivity of insulin by putting those insulin receptors and making them more sensitive. Interesting to note is that there's another thing out there that will increase the number and sensitivity of insulin receptors, and it's free. And unless you get hit by a car where you're doing it, the benefits are only good. And that is regular exercise. That's why in type 2 diabetics, the doctor's first question to that patient is, are you exercising, and are you exercising on a regular basis? Because regular aerobic exercise, 30 to 45 minutes daily, increases the number of sensitivity of those insulin receptors, and that's really their problem. All right. The examples of the thiazolidinediones are Actos and Avandia. And let's see, Invokana I talked to you about, so I think we're straight there. Well, I think that's it. I hoped it helped, and look for another video on some